How many times have you heard someone say they avoid eggs or shrimp because they're worried about cholesterol? Or perhaps you've received blood work results showing elevated cholesterol levels and immediately felt confused about what you're supposed to eat anymore. These concerns are incredibly common, and they reflect some of the most widespread misunderstandings in modern health.
My name is David. I'm a general practitioner working at Mayo Clinic in the United States. Over the years, I've seen how misunderstandings about blood lipids quietly turn into serious medical problems, from heart attacks to strokes, and how simple changes in diet and lifestyle can prevent much of this suffering. In this video, I want to help you understand what cholesterol actually is, why your body needs it, how it becomes harmful when levels become imbalanced, and most importantly, what you can do to manage it effectively. After watching this, you'll have a clearer understanding of the difference between good and bad cholesterol, why cutting out all dietary cholesterol is both unnecessary and potentially harmful, and how to make informed choices that protect your cardiovascular health without falling into extreme dietary patterns.
Because here's the truth. Cholesterol isn't the villain many people think it is. Understanding how it actually works is the first step towards taking control of your health.
Let's start with the fundamentals. Cholesterol is a waxy, fat-like substance that your body produces naturally, and it's absolutely essential for life. Many people are surprised to learn this. They've been told for years that cholesterol is dangerous, something to be eliminated from their diet entirely. But in reality, cholesterol serves as a building block for critical biological processes.
Your body uses cholesterol to produce hormones, including testosterone, estrogen, and cortisol. Without cholesterol, your endocrine system would shut down. Cholesterol is also a key component of bile acids, which your liver produces to help digest fats and absorb fat-soluble vitamins like A, D, E, and K. Without adequate bile, your digestive system would struggle to process the nutrients you need.
Perhaps most critically, cholesterol forms part of every cell membrane in your body. It provides structural integrity and helps regulate what enters and exits your cells. And when your skin is exposed to sunlight, cholesterol is converted into vitamin D, which supports bone health, immune function, and mood regulation.
So when I tell patients that cholesterol is necessary, I'm not exaggerating. The problem isn't cholesterol itself. The problem is when cholesterol levels become too high, or when the balance between different types of cholesterol shifts in an unhealthy direction. That's when cardiovascular disease risk begins to climb.
A common misconception is that all the cholesterol in your bloodstream comes from the food you eat. This simply isn't true. In fact, only about 20% of your blood cholesterol comes directly from dietary sources. The remaining 80% is synthesized by your liver.
This is why people who are thin and eat relatively healthy diets can still have high cholesterol levels. The issue isn't always what they're eating. It's often related to how their liver is producing and regulating cholesterol. Genetic factors, metabolic dysfunction, insulin resistance, and chronic inflammation can all cause the liver to overproduce cholesterol, regardless of dietary intake.
That said, diet still matters. Consuming large amounts of saturated fats and trans fats can increase cholesterol levels, particularly LDL cholesterol, which we'll discuss in detail shortly. But eliminating all dietary cholesterol, avoiding eggs, seafood, and other cholesterol-containing foods doesn't automatically lower your blood cholesterol to healthy levels. Your liver will simply compensate by producing more. This is why managing cholesterol requires a nuanced approach. It's not about cutting out entire food groups, it's about understanding which dietary fats influence your cholesterol levels and making informed choices accordingly.
Here's where things get interesting. Cholesterol itself doesn't dissolve in blood. Because it's a fatty substance, it needs to be transported by special carriers called lipoproteins. There are two main types of lipoproteins you've probably heard about: low-density lipoprotein, LDL, and high-density lipoprotein, HDL. These are what people commonly refer to as bad and good cholesterol.
LDL cholesterol carries cholesterol from your liver to cells throughout your body. When your cells need cholesterol to build membranes, produce hormones, or create bile, LDL delivers it. So far, so good. The problem arises when there's too much LDL cholesterol circulating in your bloodstream. When LDL levels are elevated, excess cholesterol begins to deposit along the walls of your arteries.
Over time, these deposits form plaques, thick, hard buildups that narrow your arteries and make them less flexible. This process is called atherosclerosis. As arteries become narrower, blood flow to vital organs decreases. If a plaque ruptures, it can trigger a blood clot, which may completely block an artery. If this happens in a coronary artery, which supplies blood to the heart, the result is a heart attack. If it happens in an artery supplying the brain, the result is a stroke.
This is why LDL cholesterol is labeled bad. It's not inherently harmful. Your body needs it. But when levels are too high, it becomes a major risk factor for cardiovascular disease. HDL cholesterol, on the other hand, acts like a cleanup crew. HDL travels through your bloodstream, picking up excess cholesterol from artery walls and transporting it back to your liver for disposal. The higher your HDL levels, the more efficiently your body can remove excess cholesterol before it causes damage. This is why HDL is considered good cholesterol. It actively protects your cardiovascular system.
When you get a lipid panel blood test, you'll see both LDL and HDL values. The goal is to keep LDL cholesterol below 100 milligrams per deciliter and HDL cholesterol above 50 milligrams per deciliter for women or 40 milligrams per deciliter for men. Higher HDL is better. It means your body is actively clearing cholesterol from your arteries. Lower LDL is better. It means less cholesterol is available to deposit in artery walls.
Understanding this distinction is critical. Many patients see a high cholesterol number on their lab results and panic, not realizing that high HDL is actually protective. Context matters. A total cholesterol level of 220 milligrams per deciliter might be concerning if most of that is LVL, but reassuring if a significant portion is HDL.
Let's talk about what actually happens when cholesterol levels remain elevated for years. Atherosclerosis doesn't develop overnight. It's a slow, progressive disease that often shows no symptoms until a major cardiovascular event occurs.
As LDL cholesterol accumulates in artery walls, it triggers an inflammatory response. Your immune system recognizes the cholesterol deposits as foreign material and sends white blood cells to the area. These cells attempt to engulf the cholesterol, but in the process, they become part of the plaque. The plaque grows larger, and the artery wall becomes thicker and stiffer. This can happen anywhere in your body. If it happens in the coronary arteries that supply your heart muscle, you may experience chest pain, angina, during physical exertion because your heart isn't receiving enough oxygen-rich blood. If a plaque ruptures and causes a complete blockage, you experience a heart attack, acute chest pain, shortness of breath, and potentially life-threatening damage to the heart muscle.
If atherosclerosis affects the carotid arteries in your neck, which supply blood to your brain, the risk of stroke increases dramatically. A stroke occurs when blood flow to part of the brain is interrupted, either by a blockage or by a ruptured blood vessel. Brain cells begin to die within minutes, leading to permanent neurological damage or death. Atherosclerosis can also develop in the arteries of your legs, peripheral artery disease, leading to pain, numbness, and poor wound healing. In severe cases, it can cause tissue death and require amputation. It can affect the renal arteries that supply your kidneys, contributing to kidney disease and high blood pressure.
The key point is this: high cholesterol is a silent risk factor. Most people don't feel it. There's no pain, no obvious warning sign. That's why regular screening with lipid panels is so important, especially if you have a family history of heart disease, high blood pressure, diabetes, or other cardiovascular risk factors.
Now that you understand how cholesterol works and why balance is important, let's talk about practical dietary strategies. This isn't about eliminating cholesterol entirely. It's about making smarter choices that raise HDL and lower LDL.
First, limit saturated fats. Saturated fats, found primarily in red meat, beef, pork, lamb, full-fat dairy products, whole milk, cheese, butter, and processed meats,
bacon, sausage, hot dogs, can raise LDL cholesterol levels. This doesn't mean you have to avoid these foods completely, but moderation is key. Choose lean cuts of meat, opt for low-fat or fat-free dairy, and limit processed meats. Second, avoid trans fats entirely. Trans fats are created when liquid oils are hydrogenated to make them solid at room temperature. They're found in many packaged baked goods: cookies, crackers, pastries, fried foods, margarine, and processed snack foods. Trans fats not only raise LDL cholesterol, but also lower HDL cholesterol, the worst possible combination. In the United States, the FDA has taken steps to remove artificial trans fats from the food supply, but they can still be present in small amounts. Check ingredient labels for partially hydrogenated oils and avoid products that contain them. Third, increase your intake of unsaturated fats. Unsaturated fats, both monounsaturated and polyunsaturated, can raise HDL cholesterol and lower LDL cholesterol. These fats are found in foods like fatty fish, salmon, mackerel, sardines, trout, which are rich in omega-3 fatty acids. The American Heart Association recommends eating at least 2 servings of fish per week. Other excellent sources include olive oil, canola oil, avocados, nuts, almonds, walnuts, cashews, pecans, and seeds, flax seeds, chia seeds.
I recognize that some of these foods, particularly fatty fish, nuts, and high-quality olive oil, can be expensive. If budget is a concern, consider more affordable options like canned tuna or salmon, peanuts or peanut oil, which also contain unsaturated fats and offer cardiovascular benefits. Fourth, increase dietary fiber. Soluble fiber, found in oats, barley, beans, lentils, apples, and citrus fruits, binds to cholesterol in the digestive system and helps remove it from the body before it enters the bloodstream. Aim for at least 25-30 grams of fiber per day. Start your day with oatmeal, add beans to soups and salads, and snack on fruits rather than processed sweets. Finally, limit refined sugars and simple carbohydrates. While sugar doesn't directly raise cholesterol, diets high in refined carbohydrates, white bread, pastries, sugary drinks, candy, can contribute to weight gain, insulin resistance, and increased triglycerides, all of which negatively affect your cholesterol profile. Focus on whole grains, fruits, and vegetables instead.
Diet alone isn't enough. Regular physical activity is one of the most effective ways to raise HDL cholesterol and improve overall cardiovascular health. Exercise helps your body burn fat, improves insulin sensitivity, reduces inflammation, and strengthens your heart.
Aerobic exercise, activities that increase your heart rate and keep it elevated, is particularly beneficial. This includes brisk walking, jogging, cycling, swimming, dancing, and group fitness classes. The American Heart Association recommends at least 150 minutes of moderate-intensity aerobic activity per week, which breaks down to about 30 minutes per day, 5 days per week. If you're not currently active, start slowly. Even 10-15 minutes of walking per day can make a difference. Gradually increase the duration and intensity as your fitness improves. The key is consistency. Regular, sustained physical activity over weeks and months produces measurable improvements in cholesterol levels.
You don't need expensive equipment or a gym membership. Bodyweight exercises, online workout videos, walking around your neighborhood, or taking the stairs instead of the elevator all count. The goal is to move your body regularly and work up a sweat. This not only improves your cholesterol, but also reduces your risk of diabetes, high blood pressure, and obesity.
Not everyone with high cholesterol is overweight, and not everyone who's overweight has high cholesterol. However, excess body weight, particularly abdominal fat, is strongly associated with elevated LDL cholesterol and triglycerides, as well as lower HDL cholesterol.
Body mass index is a simple screening tool that estimates whether your weight is in a healthy range. A BMI under 25 is generally considered healthy, while a BMI between 25 and 30 indicates overweight, and above 30 indicates obesity. While BMI has limitations and doesn't account for muscle mass or body composition, it's a useful starting point. Losing even 5 to 10% of your body weight can significantly improve your cholesterol levels. For someone weighing 200 pounds, that's 10 to 20 pounds, a realistic and achievable goal. Weight loss reduces the burden on your cardiovascular system, improves insulin sensitivity, and decreases inflammation throughout your body. Focus on sustainable changes rather than crash diets. Gradual weight loss through a combination of healthier eating and regular physical activity is more likely to be maintained long-term. Avoid fad diets that promise rapid weight loss but are difficult to sustain. Instead, aim for a balanced diet, rich in vegetables, fruits, whole grains, lean proteins, and healthy fats, combined with regular exercise.
Smoking doesn't directly increase cholesterol levels, but it damages the lining of your arteries, making it easier for cholesterol to deposit and form plaques. Tobacco smoke contains thousands of toxic chemicals that cause inflammation and oxidative stress throughout your cardiovascular system.
When the inner lining of your arteries, the endothelium, is damaged, it becomes sticky and more prone to collecting LDL cholesterol particles. This accelerates the development of atherosclerosis. Additionally, smoking lowers HDL cholesterol, reducing your body's ability to clear excess cholesterol from artery walls.
The cardiovascular risks of smoking are well documented. Smokers are 2 to 4 times more likely to develop coronary heart disease and stroke compared to non-smokers. Even secondhand smoke exposure increases cardiovascular risk.
If you smoke, quitting is the single most important step you can take to protect your heart. Within weeks of quitting, your cardiovascular function begins to improve. Within a year, your risk of heart disease drops significantly. If you need help quitting, talk to your primary care physician. There are effective medications, counseling programs, and support groups available to help you succeed.
Finally, remember that managing cholesterol is about prevention, not just treatment. Many people wait until they're diagnosed with heart disease or until they've had a heart attack before they take their cholesterol seriously. Don't wait. Get regular checkups. Know your numbers. Understand what they mean. Take action before a crisis occurs.
Your cardiovascular health is in your hands. The choices you make today, what you eat, how you move, whether you smoke, how you manage stress, shape your risk for heart disease, stroke, and other chronic conditions. By understanding cholesterol and taking proactive steps to manage it, you're investing in a longer, healthier, more active life.
If you found this information helpful, I encourage you to share it with family and friends who might benefit. Knowledge is powerful, but only if it's put into action. Start today. Make one healthy choice. Then make another. Over time, these choices become habits, and those habits become a healthier future. Take care of yourself. Your heart will thank you.